Many things aren't equal, but everyone gets the same 24 hours in a day and 7 days in a week. We make time for what we truly want. A nurse lives and breathes by these words. A nurse plays a significant role in the operations of a hospital. The nurse cares for patients in various ways, such as checking vitals, administering ordered medications, drawing blood, giving shots, observing and assessing various patients for deteriorating health conditions, educating their patients and their families and caregivers. These are just to name a few. The duties of a nurse go on and on. With that being said, the question I'm asking today is, does the salary of a nurse appropriately compensate them for their long list of job duties, rigorous training, and education requirements, plus the daily struggles of working in the hospital? Nurses are well paid for the job that they do. It's important to note that salaries for nurses can vary significantly based on experience, education, geographical location, and a nurse's ability to negotiate. According to the Nurse's Salary Guide, the average RN salary across the United States is $73,550. At first glance, this appears to be a pretty appropriate number. Let's break the number down: monthly, weekly, and hourly wages for these nurses. Even though this number changes based on experience and years on a job, the location, like I already mentioned, and your level of training, $35 an hour can be considered a pretty appropriate wage for almost anyone. The median household income, according to the US Census, was $60,000. Examining the salary of a nurse compared to the median household income, it would be appropriate to say that nurses are well compensated. But should nurses be paid more? Even though we've established nurses are making a pretty good wage based on the US median household of income, we need to ask the question if the nurse's wage is appropriate for the type of job and work that they're doing daily. For example, most nurses are expected to work 12-plus-hour shifts, are on their feet constantly, and have to sacrifice time with their friends and family, especially during the holidays. Some nurses even work night shift, which research has shown working nights are detrimental to your health in the long run. However, many will argue that it's not really any different than any other job. Whether or not a nurse should make more money can only be determined by specifics such as, again, location, levels of training, and years of experience. If a nurse was feeling poorly compensated, the best thing that they could do would re-examine the location of their job, get more training or education, and hopefully this could improve their salary. As the job outlook continues to grow in a positive direction for nurses, this should mean that the salary should continue to increase as well. This is about a 15% job growth for the nursing profession, a rate that's considered much faster than the average. Unfortunately, looking at the nurse's salary, they've remained flat in the past couple of years, even though the demand has increased. This lack of rising pay for an increasingly more demanding job is leading to burnout. Burnout is a multifaceted phenomenon that revolves around the cessation of one being able to perform his or her job. The factors that directly associate this with a nurse is the frenzied environment in which they work, the demanding roles and hours they are expected to maintain, lack of confidence in a job achievement, and lack of time to achieve organized and priority-setting schedules. As a result, an overwhelming amount of stress is being put on the nurse. As we are currently experiencing a national nurse shortage, we're seeing a rise in patient acuity. Simply put, the country's nursing staff is experiencing a greater workload at the same rate of pay with no additional network support. All of these factors are playing a hazardous role in the care of patients receiving the best kind of care. The trickle-down effect of a nurse's burnout renders patient care in very big jeopardy. A strong healthcare facility needs to have the appropriate number of staff members so they can administer care effectively, efficiently, and safely. However, it turns out healthcare industries are severely understaffing their nurses, resulting in a myriad of issues. While hiring more RNs does cost a medical facility more money up front, the benefits outweigh the monetary cost in the long run. The extent of understaffing in nursing units across the country is significant. The American Nursing Association conducted a study in which they interviewed nurses on their opinions as to whether or not their workplaces were sufficiently staffed. 50% of the nurses feel they cannot spend sufficient time with their patients. 43% of these nurses saw an increase in overtime work. 54% reported they have excess workload. 77 regularly work more than one 12-hour shift. 40% of nursing units are understaffed, and 33% of nursing units are inadequately staffed. While expanding the nursing staff does incur a cost, reports show expanded nursing staffs do not typically affect a hospital's profitability. Rather, it increases efficiency and anything rakes in more money for the healthcare institution. Nurses work long, hard hours to care for sick and injured patients. They leave their families at home and they leave themselves at the door to take care of others. A nurse's pay and job conditions must appropriately reflect this in conjunction with their line of work. American nurses deserve to be paid more.